my blank paper that I'm going to be taking notes on. And now I'm going to start my skill. Hi, provide privacy. My name's Jamie. I'm a student nurse, and I'm going to do a head-to-toe exam on you today. First, I'm going to wash my hands. And can you show me your wristband? Tell me your name and date of birth.
Rebecca Keithley, 6/22/03.
Perfect, Rebecca. Okay, so do you have any allergies?
Nope.
Okay, perfect. So I'm going to raise the bed to working height, and while I'm doing that, I'm going to ask if you can you tell me where you're at? Okay, and why are you here?
Because I live here.
Okay, what's the date today?
June 18th, 2020.
Okay, perfect. And are you able to walk independently?
Yep.
Okay, so I'm going to step back and I'm going to say she's a 16-year-old white female who's smiling and happy. She's alert and oriented ×4. Speech is clear. Her body is proportionate to height and weight, and she's able to walk independently. And okay, Rebecca, so I'm going to do your head-to-toe exam today, and then it will involve a little bit of touching. Is that okay with you? Okay, perfect. So I'm going to start with your head first. I'm going to feel for any lumps or bumps, and I'm going to look at your face, and it's symmetrical, so it's great. And then I'm going to take a look at your ears, so if you could tuck your hair behind your ears. Okay, I'm going to use my pen light, and I'm just going to pull on your ear a little bit so I can see inside of it. Okay, there's no wax, no drainage, no buildup. And behind your ear, there's no redness, no broken skin, no bumps. And can you turn your head just a little? There you go. Okay, same for this ear. No wax buildup, no drainage. No redness, broken skin, or bumps behind the ears. And do you wear hearing aids?
No.
Okay. And do you have any trouble hearing?
Nope.
Okay. And next I'm going to look at your eyes. So if you could take off your glasses. I'm going to go ahead and first I'm going to pull down your lower eyelids to check your conjunctiva. Make sure they're pink and moist, which they are. And how long have you worn glasses?
6 years.
Okay. And have you noticed any vision changes lately?
It's gotten a little bit worse.
Worse? And how long has it been worse?
A couple of months.
Have you been to the doctor for that?
No.
Okay. Well, you should go to the doctor for that. Okay. So at this point, I'm going to flash my light into your eyes. I just want you to focus on my nose. Okay. I'm just going to check and see that your pupils are equal, round, and reactive to light and accommodation. So I'm going to have you look at my pen and just follow, follow, follow. Great. Okay, so pupils are equal, round, and reactive to light and accommodation. And then I asked about your eyes, your vision. So I'm going to look up your nose now. Okay. Stills. Nasal mucosa is pink and moist. And have you been congested lately?
A little bit.
Okay, how long have you been congested for?
Just today.
And have you taken medicine for it?
Yeah.
Okay. Now I'm going to look inside your mouth. So if you could open your mouth, stick out your tongue and say, ah. Oh, can you do that again? Great. Okay. Mouth. Your oral mucosa is pink and moist. Do you have any, have you noticed a change in your smell lately? No? Okay. So have you noticed a taste in the way that you, have you noticed a change in the way that things taste?
No.
No? Okay. And do you have any dental problems?
Nope.
And you don't wear dentures, right?
Nope.
Okay. Are you having any pain in your neck? Great. Okay, so I'm going to go ahead and feel your neck. I'm going to check for swollen lymph nodes or painful muscles. Anything like that? Any pain? Okay, skin is pink and dry on the neck, and there's no pain. And so I'm going to have you do a few range of motion exercises so I can see if everything's normal. So if you could touch your chin to your chest, great, and back to normal. Then your ear to one side and then to the other. No pain with that? Okay, can you turn your head like this to each side? And any pain?
Nope.
Okay, and if you can tip your head back. Good?
Yep.
No pain?
Nope.
Okay, great. So range of motion is normal on your neck. Alright, so now I'm going to touch your arms, okay? And you just let me know if you have any pain at all or anything like that. And for this, I'm just checking to see if you have any muscular pain, if any of your bones are hurting you, do you have any open skin at all anywhere? Any sores, wounds, anything like that?
Nope.
No? Okay. Your skin is pink and dry. And warm with no open areas. And I'm going to check your pulse, your radial pulses. Probably do it in the right spot, that would help. Great. Okay, radial pulses are 2+. And I'm going to check your grip strength. So if you could squeeze, okay, pull me to you, push me away. Great, great. Strength's equal bilaterally. And I'm going to check your capillary refill in your fingernails. Even though you have some nail polish off or on, there's some places where I can still see. And this is just to check your blood flow. So, looks like your blood flow in each fingernail is good. Your capillary refill is brisk. Definitely less than 2 seconds. Okay, so cap refill's good. And I'm going to do the same thing to your feet. So I'm going to check your pulses. These are called your dorsalis pedis pulses. And I'm going to check them, which I can feel bilaterally. So dorsalis pedal pulses are 2+ bilaterally. There's no edema present. And I'm going to check the capillary refill in your toes, which is also brisk. Good. Great. Okay. Sorry. Okay, so now I'm going to assess your chest wall. So I'm going to make sure there's no pain. You're not having any, or are you having any pain in your chest? Okay, so I'm just going to go ahead and feel. And there's no pain anywhere. Nope, no pain?
No
Yes,
pain.
pain? No pain? Okay, good. So now what I'm going to do is listen to your lungs. I'm going to listen to 4 areas, 4 pairs in the front. And then I'm going to listen to the back as well. And this is just to check to see if there's any fluids in your lungs or anything like that. Okay? So if you could just breathe normally through your mouth, not your nose, that way I can hear better. Okay. And you don't have to stop breathing when I move my stethoscope. I'm going to go ahead and listen to 5 pairs of areas in your back. So you can move your hair. Okay, your respiration rate is 20, which is borderline high, but you're alright. And the depth is normal, the effort is normal, and your chest is symmetrical with rise and fall. So that's all good things. Okay. The one thing that I forgot to check is your costal angle. So if I can have you just lift your shirt up just a little bit so I can check and see. Great. Your costal angle is less than 90 degrees. So that's great. Oh, and your AP ratio is 1 to 2. Your AP ratio is normal. Okay. So now I'm going to go ahead and listen to your heart. So if you can go ahead and lie back for me, that would be helpful. And then just move your hair. Now for this exam, part of it I'm going to have, there's 2 spots that I have to listen to that are going to be under your left breast. So when I get to that point, if you could lift your bra and your breast so that I have good access to these ribs that are under here are the 2 places that I need to listen to. Okay, so I'm going to listen to your heart now. So the first place I'm going to listen to is this aortic valve. And this is where S2 is the most audible. And then I'm going to pop over here and listen to your pulmonary valve. And S2 is also very loud here. Yeah. Okay. And then I'm going to move down 1 to your Erb's point. And this, at this point, I can hear both S1 and S2 equally. It's that loved out sound. Okay, and now I'm going to move down to your 5th intercostal space, so if you could lift your, you'll have to move your hand and just lift your, so this is your tricuspid valve. S1 is more audible here. And then your mitral valve is over here. This is the point of maximal impulse and the apex of the heart. Your pulse rate's 72. So, but it's normal. The point of maximal impulse is the point where your heart is most easily felt and heard through your, if you were to put your hand there, you can actually feel it beating. Me, actually. I did ape 2-man, and I think that's it for your cardiovascular. At least I hope so. That's all I remember. So now I'm going to go ahead and assess your stomach. So have you been having any abdominal pain lately? No? And then how's your urine been?
Normal.
Normal? Okay. Do you have any pain with urination?
No.
Okay. And what color has your urine been?
Pale.
Pale yellow? Okay. And do you have an increase or decrease in urine?
No.
Okay. Have you been extra thirsty lately?
No.
Okay. And what about your poop? Have you had normal bowel movements lately?
Mm-hmm.
Yeah? Okay. And when's the last time you had a bowel movement?
2 days.
2 days. And is that normal for you?
Yep.
Okay. And was your last bowel movement also normal?
Mm-hmm.
Was not too hard or too runny or anything like that? Okay. 2 days ago. And you have no abdominal pain at all, you said, right? Okay, so I'm going to go ahead and listen to your stomach. So if you could lift your shirt just a little bit for me. I'm going to start in the right lower quadrant. Your stomach's very cooperative. Right upper quadrant. I'm going to go to the left upper quadrant. And left lower. Nice. Okay. Bowel tones are good. And one more time, there's no pain, right? Okay, so I'm going to go ahead and press on your stomach gently. Just checking for any masses or hernias in the right lower and then the right upper. And then the left upper and left lower. And there's no pain anywhere? Okay, great. So your skin on your abdomen is normal. Bowel tones are normal. And your skin, yeah, I got your skin is normal. Okay, well, trying to make sure I didn't forget anything. So I'm going to give you your call light. And I'm going to lower your bed. I'm going to wash my hands. And I'm going to take my paper out of the room. Here's your call light. Call if you need anything. Do you have any other questions or anything for me? Okay, great. So I'm going to take my recording and I'm going to go to my computer. And, oh, that's not what I wanted to do. Okay, so we're going to walk to the computer now. And I'm going to turn on my browser. Shh. Okay. My computer's a little slow. Oh my goodness. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6. I don't have my ID on hand. This is my environment. This is what I have as my notes and nothing else. It's my same. That's what I have. Just my notes. In a can, apparently. This is my environment. This is what I have as my notes